Dr. Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about an answer to a question, which is, do heel pads help with heel pain? Well, the short answer to this question is typically no. Heel pads actually do not really solve the problem that's associated with most cases of heel pain, and therefore do not provide most people who purchase them with relief. I'll explain why. Most cases of heel pain has to do with inflammation and damage to a ligament on the bottom of the foot called the plantar fascia. Now this ligament basically runs through the entirety of the arch, and its attachment on the heel bone itself is where most people develop this inflammation and therefore they have pain. But the problem really is not exactly where that tissue attaches to the heel. It actually has to do with the entire course of that plantar fascia, and in particular with strain that is associated with one's foot structure that influences the plantar fascia and causes it to become damaged. Now, most people with cases of plantar fasciitis have flat feet, although some people do have more normal foot structures, and some people even have higher arches. But the vast majority of cases are people with either flat feet or feet that are actually flattening more excessively than what's considered normal. Because of this flattening effect, there is a great deal of strain to the plantar fascia, and therefore the plantar fascia becomes injured. If one simply tries to sort of use a pad on the bottom of the heel to increase padding and shock absorption to the heel itself, they're not going to actually get any relief of this condition, because the problem, as I said, is not really in the heel or on the bottom of the heel, but rather in the arch structure and the strain that is occurring to the plantar fascia as a result of that. So therefore, a device that will go into the shoe really needs to support and stabilize the arch rather than simply providing padding to the bottom of the heel like so many simple heel pads basically provide. A good over-the-counter arch support is a great way to start, but unfortunately most store-bought over-the-counter arch supports are either too flimsy and too padded and compressible because they're made out of foam or gel or some other material that your body weight will simply smush down, or they're too hard, such in the case of many retail store arch supports that are available from arch support stores. Those devices do provide a great deal of stabilization to the plantar fascia and to the arch itself, but because they're not actually made of a specific mold of one's own foot, many people do experience discomfort related to the firmness of those inserts. A good over-the-counter arch support really should have sort of the components of both of those, where there's softness and padding that can accommodate for one's foot structure without being too smushy or too compressible, and provide an appropriate level of support. And there are a few brand names out there that do provide that level of support. Unfortunately, they're either available at specialized stores or oftentimes at podiatrist office and medical facilities. However, in the case of plantar fasciitis, this is a condition that requires a wide range of different treatments in order to get rid of the inflammation and to keep it away. And so by simply going into just an arch support or just some type of padding in the shoe as the sole means of treating this condition, well, that's not going to work. And so one really should be visiting a foot care specialist in order to get rid of this condition and to treat it properly. And a visit to a podiatrist should be able to accomplish this. Now, there is one instance in which a heel pad can actually be of benefit in a case of heel pain. Some cases of heel pain are solely due to a condition called bursitis. There is a little heel pad on the bottom of the heel itself, which acts as sort of a cushioning device to the bottom of the heel bone. And in this condition called bursitis, that pad of tissue can become inflamed, and an actual pad placed underneath the heel to allow for greater shock absorption can be beneficial in the treatment of this condition. We do see this condition, though, more frequently associated with plantar fasciitis, but sometimes it does appear on its own without having any element of plantar fasciitis with it. Well, I hope you enjoy this video. Please look for more videos on all things foot and ankle on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.